Hello guys, this is Mujib once again, and today we're going to talk about postcoital bleeding. So postcoital bleeding is the non-menstrual vaginal bleeding that occurs during or after sexual intercourse. Simply, that's the definition of postcoital bleeding. So we have common causes or reasons as to why people get postcoital bleeding. First of all, we have vaginal dryness. Second, we have cervical ectropion. So it's a condition whereby the cells of the cervix are displaced, making it more prone to bleeding. Yeah? That is called cervical ectropion. So we also have polyps or growth. Yeah? These are benign, but they may lead to bleeding. Yeah? So we also have STIs. So STIs are infections like gonorrhea, chlamydia. They can cause inflammation and they may lead to what? To bleeding. So we also have cervical cancer. So those are some of the causes of postcoital bleeding. So when do you go to a doctor to seek medical care, or when do you go for medical advice when you have postcoital bleeding? First of all, when the bleeding is heavy or persistent. So when your bleeding is very heavy or persistent, you should go and see what? A doctor. You should go to the hospital that you say doctor. So secondly, when you experience other symptoms that come after your bleeding, like pain, you have unusual discharge, you have fever or difficulty urinating. So when you experience those things, when you've gotten postcoital bleeding, you should go and see a doctor. You should go to the hospital, they check you up. So when you are concerned, when you have an STI, you should also go and see a doctor so that they give you treatment. Yeah? So when you're pregnant also and you get postcoital bleeding, you should go and seek medication. You should go to a doctor, they check you up, they give you treatment. So how do you prevent postcoital bleeding? First of all, you should go for regular checkups. Yeah, that's a weakness to very many people. By the way, you should make sure that you go for checkups. Yeah, like in our normal lives, you should make it a point to go and get medical checkups. Secondly, you should have safe sex practices. Yeah, safe sex practices. You can use like using a condom to prevent STIs. Yeah? That's one of the safe sex practices. So the third one is gentle approach, like avoid rough or aggressive sex. Yeah, those are some of the ways. I think to some people who are asking me about postcoital bleeding, you answered. That's some of the information you can get from postcoital bleeding, like about postcoital bleeding. Thank you. I remain Mujib. Yeah, please follow me up.